Hello, this is Dr. David Greene, CEO of the Washington Pain Network. Today's topic is an overview of medial branch blocks. Back and neck pain affect 90% of Americans at some point in life. Back pain is the second most common reason people go to see a doctor, just behind the common cold. Back pain is the leading cause of disability in those under the age of 45. Up to 40% of those who undergo back surgery are unsuccessful, and the cost of back and neck pain in the U.S. exceeds $100 billion every year. The intervertebral disc is the source of back pain 40% of the time. The facet joints cause back pain 45% of the time. These are the thumbnail-sized joints on the left and right at every level of the spine. And they consist of cartilage, so they're prone to arthritis just like a hip or a knee joint. They're really small, but they can cause a heck of a lot of pain. So diagnosing the source of the pain in the spine can be very difficult, but it takes a concerted effort, including a history, a physical examination, x-rays, maybe a CAT scan or an MRI. Here's a CAT scan of a slice of a spine. So you have the vertebral body, the spinal canal is here. Spine is processed, the little bumps on the back you can feel. And these are the facet joints, okay? And these look very nice. They have a nice joint. They're very smooth, all right? Then you look at this one, and, look at these ratty-looking joints, okay? The joint space here is pretty much gone. There's extra bone growth, bone spurs, and they're actually going into the canal as well. So even the best pain doctors who have fellowship trained, board certified, either a spine surgeon or a pain doctor, they get back pain wrong 50% of the time. It's very difficult to tell exactly why a person's back is hurting. Medial branches of the back, here's a nerve root here, okay? These nerve endings that come off and supply sensation to the facet joints above and below, these are called the medial branches, okay? These are not nerve roots, that's a nerve root, but these are little nerve endings. There's no motor function. They don't control any motor function in the body, just sensation to those facet joints. When you do a medial branch block, it's done for two reasons. The first is diagnostic, because if it provides pain relief, then you can reasonably say, aha, that joint was causing pain for the person in the neck or the back. Okay, and therapeutic, because the injection can provide pain relief for 3 months on average. So when you look at this, the injection doesn't go into the joint. It just goes around the joint where these medial branches are that I just showed you. Okay, numbing medicine is placed. Some doctors place steroid along with it, others don't. It's an outpatient procedure. You really don't need sedation for it. It's a very quick procedure. It takes under 20 minutes. Now, the diagnostic part is it helps pain doctors figure out if that joint is the source of the pain. If the injection works well, and it wears off after a few weeks to a few months, it can either be repeated or the person can go on to have what's known as a radiofrequency ablation procedure. And that can give pain relief for 6 to 18 months. The therapeutic part, studies show the average pain relief is over 3 months. The procedure works well in over 85% of patients, and then repeat procedures work just as well. Now, the radiofrequency ablation, if a medial branch block is performed and it wears off, most insurance companies will approve a radiofrequency ablation. And this basically just heats up and applies thermal energy to this area, and it deadens those medial branches, okay? And that can provide 6 to 24 months of pain relief. The average is about 15 months in studies. The top non-operative pain management in Washington is with the Washington Pain Network. There are multiple pain clinics throughout the state. Over 50 insurances are accepted, with over 25 treatment options being provided. The success rates overall average out to about 90% with the board-certified award-winning providers. Visit us online today at WashingtonPainNetwork.com, and then call us for more information and scheduling at 877-877-8556. I'm Dr. David Greene with the Washington Pain Network. Your pain stops here.